That's me, Tricia May Hoves, a second-year college student taking Bachelor of Arts in English Language at Don Mariano Marcos Memorial State University, South La Union Campus. So for this video, my topic is about COVID-19 pandemic that we are still facing right now. So for this video, I'm going to share a background information about the COVID-19 pandemic. I will also give a guidelines and safety tips. But before I'm going to share the information to you, I just want you to know that I research so that it will support my topic, and I will also give my own opinion to the topic. So let's start. As we all know, COVID-19 was started last year 2019, and it was first detected at the country of China, specifically in Wuhan, China. So the COVID-19 was started there last December 31, 2019. So last January, it was reported here in our country, which is Philippines, the first case of COVID-19. Most people infected with COVID-19 experiencing mild to moderate respiratory illness, and they will be recovered without any requiring special treatment since we still don't have the vaccine. So for your information, most people that is prone to the COVID-19 virus are the older people, babies, and people that is suffering from serious illness. So we really need to be careful and healthy always. The best way to prevent the slowdown of transmission of the COVID-19 virus, people must be aware about the disease or the virus, the cause of it, and how it spreads. So that is very important, so people must all know this. We all know that at this time, we still don't have the specific vaccine for COVID-19. However, doctors and scientists already doing their part. They are doing tests and clinical trials for potential treatments. Although COVID-19 only causes mild illness, still we need to take it seriously because it will lead us into danger. And take note, once you get infected, it will lead to complications like pneumonia, respiratory failure, septic shock, and worse, death. So we really need to be careful and be healthy always. As I've read some articles, researchers still aren't sure where this virus really came from and what it caused really. But there are more than one type of coronavirus that is common to people and animals, including bats, cats, and camels. And those people who are detected positive to the virus were linked to a large live seafood and animal market in China. And it was called wet market. As we all know, in China, specifically in Wuhan, China, they are selling fresh animals, and Chinese really eating fresh animal. So we are concluding, even the researchers also concluding that the virus really came from China and it started there in China. Okay, after giving you a background information about the COVID-19 pandemic, now let's move on to the symptoms of COVID-19. So, first one is headache, fever, cough, shortness of breathing, fatigue, and body pain. So, if you are experiencing just only one of those symptoms, it is better to consult immediately to the doctor for your safety and for those people surrounded by you. After giving you the background information about the COVID-19, the cause of it and where it really came from, and giving you the symptoms of it. Now let's move on to how thus the virus spreads. So let's start. The COVID-19 virus spreads primarily through droplets of saliva or discharge from nose when an infected person coughs or sneezing without covering his or her mouth. And also you will get the virus through touching the object, any object. So it is important after touching any object, sanitize your hands or wash your hands. After that, put some alcohol. And also, you can get it by touching your mouth, your nose, and possibly your eyes. So be careful always. Moving on to the things that we need to do. Okay, the first thing that we need to do is to avoid large event or mass gathering because we need to practice the social distancing and we need to avoid to go to the populated place or public places. The second one is avoid close contact. We should always practice or maintain the 1 meter or 3 feet apart to the people, especially to those people who is sick or has the symptoms of COVID-19 virus. We should always practice the social distancing not just in public places but also in our home. We need to keep distance to our father, mother, siblings, and relatives. So practice social distancing wherever we go. So the third one is wash our hands regularly. So every time we wash our hands, we need to use soap and wash it with clean water. And after washing our hands, we need to use sanitizers or alcohol, and it is better if we using 70% alcohol. So the fourth one is always wear a mask every time you are going out, especially going to public places like market, grocery store. Avoid close contact and maintain the 3 feet or 1 meter apart to people or to anyone. Always practice the social distancing. The fifth step, cover your mouth and nose using your elbow or a clean tissue every time you are sneezing or coughing. And also, avoid touching your nose, your eyes, and your mouth, especially when your hands is dirty. Lastly, stay at home as much as possible. It is the safest thing that we can do for this kind of situation. So don't go out if it is not necessary. So that's it. But before I'm going to end up this video, I just want to say that all the rules and regulations that is been given to us, we need to follow it all and do it all because it's just for our safety. And to this kind of situation, we really need to unite for us to overcome this challenge or this virus COVID-19 as one. And as a citizen of this country, we need to be responsible and always pray to God that everything will be go back into normal, not now but hopefully soon. So today we just need to be a responsible citizen, a good follower, and we need to be healthy and be careful always. So that's it for this video. Thank you for watching.